Okay, folks, it's your dude here once again from What You Think, coming to find out what you think. And I got an article here for you today from The Cool Down, written by Nick Pascal. Experts warn of indoor threat that poses serious health risk to children and the elderly, a source of health inadequacies. The call is coming from inside the house. It's a classic horror movie trope that still sends chills down your spine, even if the concept has become a bit outdated. However, the idea of a serious threat inside your home will always be terrifying. A new report from the National Academies of Science, Engineering, and Medicine highlights one popular indoor threat: fine particulate matter. The report calls on public health officials and other agencies to take measures to mitigate exposure, especially among more vulnerable populations like kids, older adults, and people with pre-existing conditions. Particulate matter, PM, is a mixture of solid particles and liquid droplets. Fine particulate matter, PM2.5, has a diameter of 2.5 microns. News released from the National Academies. PM is made up of chemicals, dust, and biological materials that come from numerous sources. Nearby industrial facilities, exhaust from gas-powered vehicles, and wildfires are some of the biggest producers of outdoor PM. Combustion sources like gas stoves, water heaters, and fireplaces all produce a significant amount of indoor PM 2.5. Exposure to indoor PM 2.5 has been implicated in respiratory issues like asthma and COPD, cardiovascular problems, cancer, reproductive complications, and neurological effects such as dementia. Another study estimates that PM 2.5 is responsible for 8.9 million premature deaths per year. The National Academy's report specifically recommends reduced exposure in schools. Children exposed to higher PM levels in school have experienced diminished cognitive growth. However, the report suggests that more research needs to be done. Exposure to PM 2.5 is significantly higher in economically disadvantaged and marginalized communities, says the report. Proximity to high polluting sources like industrial facilities and major highways is a big factor in the level of exposure to PM 2.5. While people in those communities typically live in older homes with outdated appliances, differences in fine particulate matter exposure are a source of health inequities across communities. National Academy of Engineering President John Anderson explained, "We already have effective mitigation tools available to reduce the fine particulate matter exposure indoors. We just need to use them," said Richard L. Corsi, Dean of Engineering of the University of California, Davis, and chair of the committee that wrote the report. The report outlines 4 general forms of mitigation: source control, ventilation filtration, and air cleaning, and personal protective equipment. What do some of those forms look like in your personal life? Switching to an induction cooktop instead of a gas stove is an excellent way to reduce the amount of PM 2.5 produced in your home. And buying a HEPA filter, HEPA filter, would go a long way in removing the pollution. Well, folks, that's all I got for this one. You gotta tell me what you think, though. It seems like every day they're finding some new chemical or pollution in our neighborhood, our home, our food, hospitals, schools. Chop it up in the comment section, folks. Let me know what you think. And as always, stay prayed up, stay blessed, and keep pushing forward.